All right, Lonnie, how are you?
Good. How are you?
I'm good. I'm looking forward to this. The idea behind this again, I think you and I've talked about it, but the idea behind it is really to ask some questions that I didn't get to ask and then also get a little bit of an update. Like you and I were just talking pre-show about, how things may have changed slightly,
A little bit.
from just a little bit from when we recorded back much earlier in the season. So just for those who may have not listened to the episode just yet, would you mind introducing yourself?
Yeah. So I am Dr. Lani Lawrence. I am the Director of Wellness and Clinical Services for the New York Football Giants. Prior to this position, I worked at USC as a clinical sports psychologist for about 8.5, almost 9 years. And I also was the lead sports psychologist with USA Track and Field. So kind of have my hands in different spaces, but really happy and have enjoyed working with the Giants so far this season.
So you have just tons of free time. Like
Oh,
what do you,
absolutely.
yeah,
Yeah. Like not running off
like
to a meeting after this or anything.
right. Just like reading books, watching Netflix all the
Right. Just
time.
laying
Yeah.
back,
Yeah. Easy. Easy.
There's
Sounds
not much
great.
going on in the world. So
Right. Yeah, exactly. Good. Well, so I've got a question, then we've got a bunch of listener questions for you, and I'll kick us off here. But when we spoke last time, when we recorded the episode, you were one game into the season.
yeah,
Now you're well into the season, and the Giants are on a little winning streak,
a little bit.
much to the chagrin of one of our listeners, especially the last game. You guys won last four games, I think, and struggled early. There were some tough losses early, some close losses, obviously some significant injuries. So I'm curious, what's your role been in kind of navigating those ups and downs of the season?
Yeah. So, I think what's interesting is that the importance of my role prior to the season. So with OTAs that we had, they were all virtual. We had to meet our rookies virtually, our vets, all of the player development stuff that I was involved in was all happening, I think, between the months of uh, April until about June.
Yeah.
And during that time, there was an ability to really set the culture of what we wanted the season to look like, the expectations of our rookies, but really helping our vets who were already with the Giants really understand the expectation of the coaching staff and the GM and owners before they even came into the building. And I think with different events that occurred throughout the summer, first starting off with George Floyd, but our team's response to that, it actually helped us set up what I actually see as the successful beginning of the season. So maybe to the outside world, the team struggled initially, especially with the close losses. But
Sure.
I think for the team, they were able to see how good they could be, and they were able to see how some of the values that the coaches were preaching were occurring right in front of them, like just attention to detail, focusing on themselves, creating this brotherhood, so that when we finally did get that win, it wasn't unexpected. You
Yeah.
could feel it kind of leading up. And so, I think the most important role I had was helping set that culture in the beginning. And now it's simply maintaining it and not getting distracted by the newfound attention that has maybe now been placed on the team.
How do you manage that? How do you manage that distraction and
Yeah.
because again, like what you said there is about the outside world and the perception to the outside world. New coach, all that stuff, and
Yeah.
and really you talked about setting that foundation of the culture. And what I heard in that is something as cliche as it may sound, beyond
Mhm.
or bigger than wins and losses, but now there's some wins, right? And now
Yeah.
there's, with that comes some added pressure to repeat and win some more and get into the playoffs and all that. So how are you managing those distractions?
Yeah. I'm really fortunate. I think the GM and owners have done an excellent job bringing in coaching staff, the new staff that really feel what's the word I'm looking for? Um, all having a very similar perspective of the importance of developing players
Yeah.
And so my perspective, both as a clinical psychologist, both with my sports psychology background, in really emphasizing culture and developing players and getting the most out of everyone, is very similar to the perspective of the head coach, which is very similar to the perspective of the GM. And so for me, it's kind of finding my niche and being able to communicate the same message that the coaches are communicating, that the GM or whoever is
Right.
communicating to the players. Now that might be as simple as, I'll send, I wouldn't call it a newsletter, but there'll be a weekly email or teamwork message that I send to the team. And all of those messages have um, some kind of, I don't want to say message again, but some kind of
Thread.
communication that, yeah, exactly, that really is re-emphasizing reducing distractions, paying attention to yourself, being present, how to find confidence. And so there's different ways, whether it's through email, whether it's through meetings I have one-on-one with players or during practice, that all those things can be emphasized. But I mean, even at the facility here, there was a picture up on all the TVs about a New York Post from the beginning of the year saying that we were terrible, and then last week saying that we were like the best thing since sliced bread, right? And so right there is just like a great example of how teams can get distracted, either negatively or positively, by any of the media that's going out there. And so my job is, I think, to re-emphasize those points, but in many different venues, the best way I can.
Yeah, and as you were talking, I was also thinking about how, perhaps those early season losses, served as an opportunity for the staff, coaches, and otherwise to follow through on the values that they had been talking prior to the start of the season. And now the players get to see, okay, they really do mean it. They really are valuing player development. They really are, valuing the individual and the person and what we're after here. And it's not just about wins and losses and all that. So let's go to some listener questions here.
Okay.
Anybody who's watching live, feel free to use the chat if you want to add in any other questions that we may have missed. But this is from Kelly. And she says, as a female professional working predominantly with males in the performance psychology world, what advice can you pass along to other professional females like yourself for gaining entry into and then longevity within a world like the NFL?
I wish there was like a one size fits all to that answer. I think there's I know that there's other female sports psychologists who are working with NFL, NBA teams, and their path may be very different than mine. I think for myself, though, the most important thing I could have done was to make sure that I was well trained. This is going to sound so basic.
Yeah, no,
but,
go for it.
I really want to emphasize the importance of competency, that my position here was literally 20 years in the making, that this didn't happen overnight. It wasn't just networking. It wasn't just going to the right school. To be honest, and I think I talked about this during the podcast, having confidence in your authenticity and letting that lead the decisions that you want to make in terms of what you want to study and the direction that you want to go. And because I pursued, I think with a lot of passion, different areas that I felt was important to me, that naturally led me to this position, right? And so I would say to anyone who wants to attain like working for a professional team, I wouldn't say that this is like the highest level that you could work for. I wouldn't say that it's the most prestigious. It's different. It's very different than the college model, and I don't think that people really really appreciate that without the right level of training, without the right level of supervision, without the right experience at different levels, you will not be successful here. You might be able to get your foot in the door, but you're not going to be able to survive here because it's so competitive and it's so, it can be so criticized that unless you have the right training, competency, supervision, experience before you get here, you're not going to thrive. And so I would tell any student, really making sure that whatever you do, whether it's a practicum class, whether it's a course that you're taking, that you're making the most out of those moments, because I think that's what got me here. There are people who I didn't realize, I'll stop talking after this.
No, you're good.
The Giants didn't ask for a reference. They never asked for a reference list. What they did do was hire someone to comb through my social media. They hired someone to search my contacts. And they hired someone to identify people within different organizations that I was working in to provide them information about how my background will best fit with them.
Yeah, wow.
And some of the people that they contacted, I didn't know either had an association with the Giants or I didn't know would be contacted. So Joe Schmo, who I may have worked with 10 years ago at a different university, was the person that was contacted to see whether or not I would be a good fit or a good person. Yeah. And if you're burning bridges left and right, if you have interpersonal issues, or if you're doing things that maybe aren't a good fit, or the opposite, maybe you're amazing, maybe, right? Sure. But that was something I had no control over that determined whether or not I was going to get this position. Yeah. And so, again, I would really emphasize competency. I would really emphasize creating genuine connections with other people, because those are the things that are going to help you get into this position. So.
Yeah. And I think that's, while it might be simple on the surface, like I think it's really important work. And at the same time, I think we'd be remiss if we didn't talk about the reality that, being really good at what you do, is received differently for men than it is for women.
Yes.
And a colleague of mine was pointing me to a direction of a book, excuse me, recently that was co-authored by Marshall Goldsmith, and who wrote "What Got You Here Won't Get You There," and the book is titled "How Women Rise." And one of the concepts in that book is essentially that being great is part of it, but then being able to and willing to a little bit communicate that in a way that is truthful and authentic is important for women to do.
Mm-hmm. It's so funny that you mentioned that. I think, I don't know if women suffer from imposter syndrome more than men. I think men do a better job in maybe covering it up, that there's a lot more posturing and maybe this fake kind of confidence that comes through that women maybe have a little bit more of a challenge doing. But I certainly realized that for myself, like that difference between when we first talked during Pittsburgh toward now, my ability to be able to articulate my usefulness, how players would benefit meeting with me, how coaches can utilize me better. Yeah. I had to make the jump of being able to speak on how I can contribute to a player doing better, how I can contribute to a team being in the best position to win in a way I had never needed to do before, especially working at a counseling center where there's a lot more empathy, a lot more support, development, and growth. Here, if I don't say it, somebody is more than happy with less experience, less education, less training to tell whoever needs to hear how well they'll be able to do this job.
Yeah.
And if I don't articulate that other person can easily eclipse any kind of relationships or connections I've created in this system. So I think that's actually a great point. I think that has been one of the more challenging things I've experienced, because I think, I don't know if it's being humble or just being more reserved, but that has definitely been a skill I've had to learn in order to make sure that coaches and players and everyone else understands how my presence benefits them.
Yeah. And I think that's powerful. That's a very powerful message, for anyone in the field to
Yeah.
hear. And I think it's important for women and men alike. And I appreciate you sharing that. I think that's a really good one.
Mhm.
So we've got a couple questions. We got one in the chat box there from Matthew Monaco and a couple others from listeners previously, but they're all in the same vein. Essentially, the question is, what's been the biggest surprise for you working in the NFL? What's the change or the transition been like from college mental health and wellness to your role with the Giants? On our episode, we talked about how at the college level there's a different space, perhaps more space for a therapeutic bond, right,
Yeah.
with the athletes. But with the nature of the NFL, players can be cut at any time. How are you, and how have you been making that shift uh, over the last couple months now?
Yeah. I would still say that has probably been the biggest difference, that you can have somebody come in for a week because perhaps they bring a skill set that's needed um, against whoever team you're playing, and they bring that expertise or skill in, and then they're cut after that week. Sometimes it's
Right.
not that obvious or apparent, and so being able to create relationships with the players, again, I think it's really come down to being able to connect with them in different venues, different points. So, for instance, like I was saying before, there are emails that I'll send out to the team once a week. And in those emails, I'll encourage them to reach out to me if they have any more questions or if they want to learn more. And it's actually interesting. I'll get a lot of responses of players who want to learn more, whether it's about mindfulness or whatever else I wrote about. But I'll also get responses from players who are like, yeah, I don't, I'm not a big fan of meditation like that.
Right.
That's not the thing. But either way, they're talking to me, which is like, it's just actually great that they can, and they're not being rude when they come up. They're just like, yeah, like I've actually been reading it. I don't really understand the mindfulness stuff, but I really enjoy this. And that is helpful information. There might be other times just being in the cafeteria. I think one of the biggest things, one of the most important responsibilities I have is being available 24/7. Now, some of that's just over the phone, but some of that's being available during practice. Some of that's being available during breakfast, when we travel, on the road, uh, during meetings. And that availability is something that I don't have with college players,
Oh
right?
yeah.
College guys are going to class, they're running to and fro. I might see them at practice once a week, but then I have this huge caseload. That's kind of flipped here in the
Hmm.
NFL. So the bonds that I don't necessarily get meeting with a player who's been around for 4 years, the difference is that I have more opportunities to connect with the players because I'm physically in the building with them. I'm physically on the field with them when it's raining outside and downpouring,
Right.
and I have a conversation with them. And that's allowed me to make those connections a little bit more quickly than I would have on the college level. And I feel really privileged that I have those opportunities. But I don't think that's the case with every team.
Can you talk a little bit more about, like, if we followed you around for a day,
Yeah.
what would we see? What are the, besides standing in the rain, that's
Yeah.
a very important thing to do, right? But it is. I mean, it's sort of shows the players that, hey, I'm here
Yeah.
with you, and
Yeah.
I'm not hiding in the warm building. I'm out here with you,
Exactly.
working with you.
Yeah.
And but aside from that, what would we see? What would be some of the kind of conversations you're having with players, the work that you're having? Maybe that player who, obviously you don't have to share any names, but that,
Yep. Yep.
the type of player who didn't resonate with mindfulness. What's the type of work that you're doing throughout the day?
So I think it depends on the day. But for people who aren't aware of like the NFL schedule, Monday is kind of like
Mhm.
a recap type of thing. Tuesday is a day off, but I'm still in the building. Wednesday's for us almost like a walkthrough. Then Thursday's a really challenging day, and then Friday it's kind of easy in the morning. Then it trails off. It's one of the reasons why I'm available
Here we are
during
now.
the afternoon. Yeah,
Yeah.
exactly. And then the regular season differs a lot than training camp. But let's say, for instance, on Tuesday morning, I'm going to be spent meeting with the guys in IR. So I'll be checking in with all the players for like basically 2 hours. We have maybe about I think offhand, maybe 8 guys who are on IR. I'd be
Mhm.
checking in with their how rehab's going, any recent meetings with their surgeons, how they're progressing, updated timelines of when they're going to return to play, meeting with the athletic trainers to see if there's any updates with, how they're responding to treatment. And so Tuesday mornings is strictly in the training room. And then maybe around like 10 or 11, there's like a meeting that I'll have that's kind of separate from my sports side responsibilities. And then the afternoon is spent meeting individually with players. And so those meetings can vary. That could be meeting with the players strictly on performance. There's, I was really fortunate at USC. We created a mindfulness program with our student athletes. That's something that I've taken with the Giants, and I'll go
Oh,
through our
cool.
players with. Yeah. Other meetings could be, somebody's, I'm trying to be thoughtful. There might be different situations where I might be meeting with a player having to adjust to something that has come up that week
Sure.
and helping them set goals that they want to achieve to be ready, for the weekend or something like that. Other meetings could be with the GM, could be with the director of medicine, could be touching base with the head coach. And so that might provide you a little bit of
Yeah.
kind of like the ebb and flow of how the day goes. There's some days where Mondays I'm just in meetings all day and it's not with the players. I help, there's a like Wellness Wednesday that I do with staff because of COVID, just to provide a space for everyone to come around and be able to talk about what's ever going on in their week. I also help lead our diversity and inclusion group. And so
Hmm.
I'll have several meetings with people within that committee about the different initiatives that we have. And then there'll be a meeting about assessments. And so we're creating or finalizing an assessment that we're using for the draft. That
Hmm.
was like my Wednesday, just going through all those meetings and then going to practice and then maybe following up with a couple of injured guys. So, so depending on the day, it might look a little bit different, but it's certainly not like college where I'm meeting with maybe 22 individual athletes all week,
Right.
doing an outreach with a couple of different teams, and then maybe attending a couple of different practices. It's certainly a lot more collaboration and touching base with different people within the organization throughout the week.
Yeah.
Hopefully that kind of gives you a sense.
Yeah, for sure. We got a couple questions, along a similar line here, and from Sarah, from Angie. We've got another question here on the chat that I'll bring up in a second. But um, you wear a lot of hats. The work that you do is very comprehensive, and just in what we're talking about, I can add to this hat list that I have here. Psychologist, performance coach, advocate, but now we've also got assessment guru. We've got all this other stuff, that these other hats that you're wearing. How do you navigate? I guess another way to ask that is, how do you dive deep into each of those roles without experiencing burnout?
Yeah, it's actually been a bit of a challenge um, because you're right. There's a lot of different roles that I hold. So some of it is the performance piece, some of it's the clinical piece, some of it's the assessment piece. More recently, it's been the DNI piece. And then on top of all of that, also being a support system for the staff
Yeah.
that, um, uh, depending on how well you follow the Giants, there's been a couple of recent deaths that have impacted the organization
Hmm.
and figuring out ways to best support them through that. So, um, I what I really realized in being an effective leader, and it's so basic again, is this piece of attention to detail and being organized. That those two things make such a huge difference in how I'm able to balance all these different roles without feeling like I'm being overwhelmed. And so the organization is just simply, scheduling, making sure that I'm not overwhelming myself. Even doing the podcast with you was it was very calculated, and being able to measure what was my threshold energy
Sure.
wise. do I have time? Do I have the mental capacity to really dive in and do this? For other stuff and other projects, being able to figure out what I want to say yes or no to, because fortunately, I think because of my position, I'm getting more opportunities to maybe do things outside of the organization, but I also have to remember that my primary job is with the Giants. But
Are you getting better at saying no?
no, I'm not. but at least there's some self-awareness there.
Right.
There's some self-awareness that I'm getting better at. And again, that attention to detail, that if I'm going to do something, I have to do it well. Now, I say all of this is I'm able to float, I think, above this right now, knowing that my position and job is just the beginning of the program that I hope to create. That, within the next year or two, my hope is to bring in reinforcements. Someone who may help me with like the clinical side, someone to help me with maybe the performance side, certainly someone to help me with the D&I side. And knowing that I'll be able to create this program does relieve some of the pressure that I need to do everything now, that I need to have it all figured out now. I have, this plan in my head of how I want to be able to resolve some of the things that I'm working on. But I think more importantly, I have the support of the organization. I have the support of colleagues that even with the D&I stuff, that is not me doing it alone. Some of the clinical stuff, one of the best things I've done, actually, I should probably do a shout out to like Mike Zito and a couple of other guys in New Jersey. Part of it has been creating a network, a system to support some of the work that I'm doing so that I'm not by myself. And I think certainly another piece is being connected to colleagues that I can talk to, that I can consult with on a regular basis. So even though I'm wearing many hats, there are these different areas where I feel very supported, and that I know that if I'm feeling overwhelmed, I have a place to go to or someone to contact to seek more support. And that's been really, really helpful.
Regarding the idea of bringing in reinforcements. So anybody out there that's watching this or listening to this,
shore up your in like 1 or 2 years.
Shore up your social media. Start repairing those burned bridges.
Exactly.
Because they're gonna find it out either way.
And I want to comment, like I'm not there was somebody within our organization who initially was not hired because the Giants had gone through the social media.
Yeah.
And it was nothing like a parent, but like had some concerns. And fortunately, he had a colleague who encouraged them to interview him again.
Wow.
And they were able to speak to him about some of the social media. So I'm not being like, that was literally something that had happened within the organization that prevented someone initially from getting a job. And so anyone who's listening, like go through your social media and clear things out.
Yeah. And then the other thought, are you still getting times for Friends episodes?
You know what? I actually got distracted by Schitt's Creek. So
you did? Okay, good.
I did. I know. It's just so good. And there's 6 seasons of it. So I have not updated my Friends episodes since we talked. I feel a little guilty.
It's hard to turn off Schitt's Creek though. Once you get that going, it's so good. So another question here. We got one that came up on the chat window here, and the idea is essentially, I'm going to read it here. So related to one of your responses in the podcast, I'm a strength coach outside of work and find it more satisfying than sport because I get to interact and make relationships with all sorts of athletes. After listening to the podcast, I'm very interested in the psychology side of strength and performance training. And it's interesting because you brought this up. You talked a little bit about like being in the athletic room, a little, in the athletic training room. So what would you recommend, and where to start to pursue that aspect? I think of this as Megan Wilton, who's chimed in here on the chat window, talking about it as, in addition to the work that she does. So sort of educating her in the strength and conditioning space to then be able to support, either a sports psychologist or a mental performance coach, and then have that knowledge herself. What would you recommend?
So let me just make sure I understand this correctly. It's a strength and conditioning coach who wants to learn how to better incorporate performance psychology into the work that they do.
Yeah, that's the way
Okay.
I'm reading it. Yeah.
Yeah. So I think a lot of programs do this, athletic training programs, physical therapy programs, maybe kinesics programs, especially those who want to do strength and conditioning, having students take sports psych courses. To be honest, even though I'm around, our athletic trainers, probably our nutritionists and our strength and conditioning coaches, by far have a better relationship with the athletes than I do. They're seeing them every day. They're
Yeah.
working very
Right.
personally with them and developing them. They're going to notice personality changes or issues that are coming up way before I'm going to.
Right.
And they're going to probably be told before they even tell me any kind of personal issues that are arising in their life. So being able to recognize that is extremely helpful. And on the clinical side, being able to know when to refer that to a clinician is super helpful. But when it comes to just strictly the performance side, you know, there's such a piece of sports psychology that I think is so helpful. Whether it's, you know, having athletes recovering from injury and helping them being able to like reestablish confidence in the work that they're doing, or if they're just looking to build, being able to direct them with how they can remain focused while they're in the strength conditioning room, how they can visualize what they're trying to accomplish, being able to set goals that are realistic to help them kind of achieve whatever they're going after. So there's certainly concepts of sports psych that I would think would help a strength and conditioning coach. But I guess I wish I had, you know, like a catch-all in terms of like of a book or strategy of how to like most effectively incorporate, you know, mental skills into strength and conditioning, but I'm kind of struggling for some reason.
I think what, you know, what's coming to mind for me is, you know, pick up some evidence-based work, you know, whether that is a textbook, right. Or, you know, getting some articles going, you know, in a sports psychology journal, connecting through the Association for Applied Sports Psychology, doing something like that, because, you know, what I'm finding and seeing out there is there's so much information that is being disseminated that, you know, is by a charming, good-looking individual on Instagram or YouTube, and you know, is just sort of this tips and tricks kind of stuff, and isn't really always, not always, but founded in you know, evidence-based literature. So I think that would be my recommendation. I think that's what you're sort of leaning towards as well here a little bit.
Well, yeah, and I think that's actually a good point. You know, it didn't even occur to me, like unfortunately, that you know that people may just pick up a random book and want to immediately incorporate it, right? That having effective training or classes that you know are but you're saying like evidence-based, how important that is, and being able to utilize sources, whether that's from ASP or whether that's from APA, but really being able to find evidence-based information that can be helpful for you to apply it. But I think it even goes a step more, you know, to do that on your own, maybe asking a lot.
Yeah,
and
good point.
You know, like my bigger recommendation would be maybe to think about getting certified. And how can you incorporate maybe some courses that you would take through, not through ASK, but to obtain CMPC status, to apply that into the work that you're doing as a strength and conditioning coach. Like to me, that would be actually the ideal. Because then at least you're getting some mentorship and you're not just kind of guessing on your own, even if it is evidence-based. So yeah, that's a great
really
point.
Good. Yeah, go beyond that idea of self-study. But if you're going to do self-study, you know, try to find some evidence-based stuff. But then really the ideal is to go beyond that, get some mentorship, get some supervision, and do it the right way.
Yeah.
So looking back into, you know, your work here with the Giants, we got a question here from Donnie. One would expect that players seek coaching when things are going poorly. Are you seeing that? Is that a trend that you see?
And when you say coaching, you mean like actual coaches? Like if things aren't going well?
No, I think when they seek, performance enhancement or
Okay,
yeah,
got it,
yeah,
got it. I see both. I see both.
yeah.
Um, I certainly see, well, not even playing poorly. That's not always the case. I definitely see players who think they're about to get cut all of a sudden
Oh,
have the peak interest of sports psychology.
right,
Like, you know,
right.
um, so that's certainly one group, one demographic. And it's typically, unfortunately, a little bit too late. At that point, when you're
Sure.
getting whispers and stuff, like you're probably already out the door at the time you just isn't there. Another group, though, would be young guys,
Mm.
whether they're rookies, first year, second year, who are really open to sports science. What's great is that sports psychologists are now becoming more of a thing in college. So it's something that some of the younger guys are really comfortable with and seek out.
Yeah.
Um, and they want to learn more. They want to get that edge. And that's amazing. I love when our young guys just reach out to me personally wanting to learn more. And then I'll see vets who are really confident in themselves and their ability, and they're curious about how they could do more. They saw the documentary with like Michael Jordan, they've heard about
Right,
Kobe,
right.
even J. Cole, Kendrick Lamar, they're all
Sure.
big into
Yeah.
meditation. And so they're hearing these really elite performers utilize the skill. And it's like, I don't really get it, but if these guys are doing it, I want some of this. And so I have this other group of players who come in wanting to know more about what these guys are doing. Like
Yeah.
how do I get to that status? So sometimes it's players who are struggling and wanting to get support. That certainly happens, but I do think that there's beginning to be a deeper appreciation for sport and performance, and wanting to know how that, I don't understand it, but I want to know how it can help me. And that's been
Do you
great.
do you see a common or a regular topic of discussion? Is it a need for focus? Is it a need? Is it confidence? Is it
Mhm. Mhm.
uh, you know what are the common sort of themes that show up in the practice?
I would say, without a doubt, it used to be anxiety when I worked with, and it
Yeah.
might still be anxiety when I
Right.
worked
Right.
in college. But to be honest, it's not just anxiety, it's really been confidence.
Yeah.
And if I'm a young guy, you know, if you think about it, since Pee Wee League, you've been successful. You've always started.
Absolutely.
You've always
Yeah.
been great. And here you are, fighting for your job against, other athletes who have been around for 5, 8 years, perfecting what they do every single day, and or uh, you're someone who finally gets that chance and you've been around as a vet, and you want to make sure that if somebody's bringing you onto this team, you're maximizing your time here because you're tired of
Hmm.
bouncing around, you're tired of not being in the same place, and
Hmm.
you like what's happening. And so, what do I need to do to stay here? And I know that I'm being hesitant, and this has to stop. So I would say the common theme that I'm seeing is confidence and making sure that they're maximizing opportunity while they have it.
Is it confidence in their ability to execute? Is it confidence in their ability to learn the system? Because
Mhm.
often when we see hesitation, it's not so much confidence in my ability. It's sometimes confidence in what's the right decision.
Mhm.
Either one I can do great. I just
Mhm.
got to know which one's the right one. And so that's where the hesitation comes from often that I see.
Yeah,
What are you seeing there? Is it in the learning or is it in the execution?
I think at this level, I think you're absolutely right. There's so much that they've already learned. Now it's just fine tuning, and it's being able to execute that fine set
Yeah.
skill in the moment when it's needed. I can do it pretty well, like in practice. I can do it pretty consistently, but as soon as a game starts,
Sure.
it's a distraction. Um, or it could be, I know I'm good, but this guy, like, you know, this guy that I'm trying to beat out, he's been around.
Yeah.
And now I'm kind of questioning or second guessing. And for me, it's going back to, what are your strengths? There's not a mistake that you're here. It's not that like the GM or the head coach or whoever didn't take time, hours researching and reviewing who to bring in. Like, you being here is not a mistake. There is a specific reason why you're here to execute. You probably already know what they are. What are those one or two things? And maximize, the whatever out of it.
Right.
That is your bread and butter. That is what you're going to. That is what you're focused on. And so now, whenever you question or hesitate, you have something to come back to, something that you know, that you believe, that's authentic about how you're going to execute whatever you're doing. And so, so sometimes just reestablishing what they already know, and other times it's helping them being able to let go of any distractions they have of failure when it's time to actually play.
Yeah. And do you, how do you get them there? Is it a dialogue? Is it just getting them to reflect, on their best self? Is it other, what else? What are some tools that you use?
Yeah. It's interesting. I think when I spoke previously, I don't think I mentioned that I have a psychodynamic background, which is really odd. I think as a sports psychologist. Yeah. And so when I talk about connection and authenticity, it's not just like, hippie lovey things that I enjoy. It actually comes from theory, and this idea that if you can identify how people can better connect with others, that they themselves will thrive. And so in order to be able to understand that better, one of the things I do is get a better understanding of, how long these experiences have occurred. So it's this thing about anxiety that you felt, has that always been present, or when was the moment that there's been a shift? And usually they can pinpoint it.
Right.
And for some guys, it's always been there. Like, I just, when I was in college, I would have these great practices and then it would come to a game, but I was able to resolve. And as they talk through their story, sometimes the answers that they're seeking come up themselves. Like, well, I did talk to a coach and he did, or this is what actually happened to help me out. So sometimes it's really easy. Sometimes it's just giving them the space to speak about their experience, and they're able to remind themselves of what's been helpful tools in the past. Is there anything from that experience that we can apply now?
Yeah.
And that's lovely. Like, I did my job. I provided space. Therapy's great. And then other times it might be, even though I have a psychodynamic background, I'm a huge believer in mindfulness and meditation, and it's really helping them understand how being able to become more mindful of their body, of their thoughts, of their emotions. They can have a better response to any anxiety or distractions that they have in the moment when they're trying to play. And it's helping them be able to trust that practicing meditation on a consistent basis, being aware of their emotions as soon as they can, reducing judgment, even things that I didn't think football players would respond well to, like this piece of self-compassion and being patient and empathizing with the reaction and the stress that they feel, that some guys respond really well to that. And by doing that, by creating better focus, a better response to some of the anxiety that they're in, develops confidence, because now I feel like I have a little bit of control over how I respond to stuff. So it really depends, I think, on the player and the individual. But either way, I think it's creating the space for them to be able to think through what would be helpful for them and letting me guide them to that.
One thought that came up when you were talking about the idea there with mindfulness and, them seeing other people, engaging in mindful practice or meditation. How do you help players build mindfulness if they're not interested in meditation?
Yeah, that's a great question. That's a great question. I don't think you always have to talk about mindfulness. I think there's some players who respond well to it, who they're analytical, they're academic, they want to learn what it is, how it's useful, how it's applied, what they need to do. Right. But I certainly think there's other players that that if I'm having a conversation with them and they don't necessarily really are bought into what meditation is or mindfulness is, but they're struggling, being able to simply talk about blocking distractions and coming back to yourself, coming back to a place that, whether it's like whatever home in the body or coming back to whatever goal you have set, you're still talking about mindfulness in a way, but in a term that I think that's actually been one of my biggest learning curves, how to take concepts and be able to articulate it in a way that immediately helps them understand how it's going to help their performance.
Yeah.
And if I'm able to do that, with some of the players, they respond much better. I mean, of course, they respond much better to any suggestions that I would have.
Especially if you're using their language and stuff that they're comfortable with.
Exactly.
We got another question here from Matthew on the chat, and I've got a little twist on it as well. But he asked, Dr. Lawrence, do you find your work being more clinical mental health based, performance based, or a good blend combination of both? Mm-hmm. And my kind of addition or twist to that a little bit is, if you find yourself talking to somebody on the field and the relationship with them is perhaps more clinical mental health based, is there a threshold, or what might that threshold be for you to say, hey, let's take this into a private space?
Yeah. So I think I'm assuming that maybe some people who are listening kind of have heard about the continuum,
right.
That there are, issues or symptoms that are more severe than others. And, from psychiatry utilizing medicine to help people toward sports psychology that's looking at performance. And so I certainly see myself on that spectrum, that I can support athletes who are struggling with depression, anxiety, disordered eating, and everything else. And I can also support players who are looking to improve their performance and develop mental skills. And so, that range for me feels pretty natural. And players kind of approaching me within that range too. Typically, it's either one or the other. I know that there's some people who feel like every performance issue is clinically related. I don't believe in that.
Sure.
Right. I think some performance stuff is just performance stuff, and you don't have to go into the clinical matrix at all. But so I see myself operating in the spectrum, and depending on what the athlete brings up to me, we identify together whether or not it's clinical or not, or whether it's performance. So that doesn't feel as confusing to me. Now, the situation with the player being at practice, maybe opening up a bit, that's maybe happened on a rare occasion. I'm not trying to have full-on conversations with players during practice, because the way the practices are structured, they need to be paying attention.
Exactly.
Yeah.
Yeah.
And so there might be some side conversations for some moments, but there's never enough time for the players to be on the sideline to start divulging all this information. Where I was like, well, hey, whoa, buddy, like, this is the space for all of this. But there's certainly been times where players have opened up, and before they run off, I've shared, hey, I would love to continue this conversation with you. Let me know when you want to meet up again.
Right.
I think it would be really helpful for us to touch base. So that certainly helped, has been helpful, but there's never been a time where I felt like, hey, I need to set you aside, or I need to let you know we can't have this conversation right now. But that's just the nature of how practice is for us.
Yeah. Cool. A couple more questions. I want to honor your time here, and I know you got another meeting to run to, and I'm wondering if that means literally run to. So I don't want,
No, you know what? One great thing about working in the for an NFL team is there's not a campus. So any running is either upstairs or like down the hall, and not like across
true.
some town somewhere. So it's never that.
Yeah. Wave to Tommy Trojan on your way by.
Exactly.
So this is from Megan on the chat here, and then I've got one more after this. But Dr. Lawrence, how do you distribute your emotional energy when players don't buy in? Essentially, she's asking, what is your draw the line in the sand in trying to help somebody?
In college, that was more of an issue.
Yeah.
because you would maybe have players more likely, depending on the university that you worked with, that was maybe mandated, whether it's through like Title IX, something happened, and they need to come in, or it was a positive drug test or some kind of injury, that
Right.
there's
Coach's
less,
recommendation.
yeah, exactly,
Yeah.
or strongly recommend,
Right.
so you would get a student in front of you who didn't want to be there, who's just, following something that the client said that they had to complete. Or it's a player where the coach is frustrated with them and highly recommended for them to come in. They're just doing it as obligation. I think for the NFL, the coach has a problem with you. You're not here. And let's say you're
Yeah.
Go ahead.
Well, my one thought on that is, so, okay, coach has a problem with you, you're not there, but
Yeah.
but there is a threshold even for that. Like,
Right.
if
But
there's
before it
players that
happens.
are not buying into the system,
Right.
but are dominating on the field. I'm not saying with the Giants in general,
That's a
but
good point. So that's a great point. So I guess what I would respond to is that sometimes there are players who don't want to come in or will need a lot of coaching. And my job isn't to convince a player to come in.
yeah,
My job is not to force someone to come in, demand that they come in, tell them how great, not that people are implying this, but how great I am and how I'm going to change whatever you're doing. You need to come in and meet with me.
right.
Unless it's a safety issue, I'm not going that route. Like if I'm really concerned about the safety and welfare of you or immediate family members, it'd be really rare for me to even make that recommendation. What would happen though is that I would, if there are issues going on with the player, typically they're being noticed by the athletic trainer, the conditioning coach, other staff members, and I would work in conjunction with them to figure out the best way to be able to speak to the player and have them touch base with me, even if it's just once. So that could be a strong recommendation from an athletic trainer or strength and conditioning coach, might be even from the chaplain or player development. But there would be a system in place where we would work together to figure out the best way to bring the player in. And I always provide an option of someone outside of the Giants. That if I'm not going to be the cup of tea for everyone. And the whole reason why I have a network outside of this area is to make sure that players have options aside from myself to meet with someone. One quick thing I'll say too is that there's a group of people that meet at least once a month with myself, the chaplain, team physician, and a couple other people. And we'll discuss any concerns that we have about a player so that we can preempt any ongoing issues or any behaviors become more problematic. We try to do things preemptively to make sure that we're what's the word I'm trying to think of, intervening as quickly as possible as soon as we see an issue. So that is a thought about how to best support players who may not be open to meeting with me.
Right.
But it's really utilizing staff around me to provide that network for all those.
Yeah. Awesome. Well, last one here. So looking, to next year and beyond, what among player wellness and development do you believe is the biggest need that still hasn't been addressed and needs to be brought into awareness and needs to be addressed? If any.
Mm-hmm. Good question. Just 2020 has just been a whirlwind. And I really truly believe that the Giants have done an excellent job in providing players support through all the different pandemics that we're facing, racial injustice, COVID. But there's only so much you can do during the season because it's just so quick and fast paced, and not everybody's in the building. And so the players don't have all the support systems that they're accustomed to while they're here. And my biggest concern is that after the season, everybody's going to be going to their own places. and the adrenaline of the season is going to drop.
Right.
And
Right.
the challenges and difficulties that have impacted the players, coaches, and staff, there's no longer any distractions from facing them or experiencing them.
Mm-hmm.
And so I certainly would maybe have some concern about whether it's levels of anxiety or depression or isolation, people who lost loved ones from COVID, people who are concerned about loved ones and police brutality, people who are concerned about the election or what have you. I guess my one of my bigger concerns is how do we provide support to players and coaches who are no longer in the New Jersey area, who are
Right.
now off by themselves and are dealing with some of these mental stresses on their own. And that's going to be something that I hopefully won't have to figure out for another 2 months, but
Right. Yeah. Yeah.
but certainly something that's on my mind.
Yeah.
And
That's an interesting idea
yeah,
there.
and ways to support all the players and coaches while they're gone before they
Right.
return in a few months.
Yeah. I mean, in some regard, you're kind of in this in a bubble.
Yeah, it's really
Not literally, obviously, like the NBA was, but you're in a bubble there, and then when you go out of that bubble, how do we keep you wrapped in our arms, right? And having the support and services that you need, should those stuff rebound, that stuff that's been troubling you rebound because you'll be able to push it aside to focus on play.
I really feel like that the team has been in individual bubbles. Like each player, each coach is in their own little bubbles, even though we're not all in the same place. And so but that's going to be all wrapped,
Yeah. Yeah, exactly. Again, hopefully, longer than right. Yeah, exactly. Yeah. Well, I'm excited to continue to learn from you, and I've learned a lot from you today, and of course on our last podcast episode, and also to see the evolution of your role. I'm excited to see that, and I know it's continuing to evolve, and you're continuing to cement yourself as a leader, and looking forward to that, and I really appreciate you being on. So thank you for joining us here.
This has been great. Thank you so much. I love talking to you. Can't wait to do this again.
Yeah, we'll do it again. All right. Be well.
You too.